This is my thug thizzle. All right, hey cousins. So today I'm coming live, not live, but I'm coming from my car today. It's gonna be another story time while I do something with my hair. I guess you can call it car chronicles. But this is a old twist out, and I'm going to do a puff. I haven't done a puff in my hair in a while. Oh, look at this definition. It is still defined though. Ooh, talk to me. But that's only in certain areas because you know this front, girl, it do its own little thing. Back here, let's see. I don't know. But this is a 3-day old. Let me see. I took my twist out Saturday, Sunday. Today is Monday. So this is a 3-day old puff. Twist out. And I'm just going to put it in a puff for work tonight. But it's going to be a story time. And I am going to talk about the different nursing gigs that I've had over the past 11 years. I got my water bottle. So, you know, I've been nursing for 11 years. One of my videos, I said 12 years. But in actuality, it's been 11 years. I kind of jumped the gun on that video. I don't know. So I started out, first of all, it was hard for me to get a job. I don't know. Everybody's like, oh, you an RN. Oh, you should be able to find a job anywhere. Girl, that was not the case. Them people wanted experience, and I'm like, how can I get experience if you guys don't want to give me any experience? And I felt like they weren't even really looking at my resume, and I did not have a BSN at the time. I was just a regular ADN. So I think that probably played a part in it as well. But I was like, I don't even think that they're looking at my resume, because if I can get the interview, I feel like I can get the job. This is Talia G, the Great Detangler. So finally, I got my first opportunity at a drug rehab facility, which was a place where addicts came in to attempt to get clean. Sometimes they came in voluntarily, and then sometimes they were court mandated, or sometimes they were forced by their family, like they would be cut off from their financial monies and whatnot if they didn't get rehab. We had all types of walks from the age of 18 through like 80. I remember one guy, he was like 79. They were rich people, poor people, black people, white people, you know, other races. There were nurses, doctors. Oh, it was so many different people. And I felt that job to be very rewarding, because it allowed you to see people come in at their low, and then they work their way through the program, and they get better. So you could see them from day one through day whatever it was, and they were like a new person almost. And that was very rewarding. Now, basically, as the nurse at the drug rehab facility, you're doing a lot of babysitting. You're doing a lot of, no, you can't do this, no, you can't do that, and monitoring. So like when they first come in, they're going through their detox period. So you're basically monitoring them, making sure that they're not, you know, like seizing and taking their medications and whatnot. Then you got to make sure that they're going to their group therapy. Basically the only nursing portion of it was if you got a chance to work in the med room. I didn't bring a comb. That's smart. Okay, so if you got a chance to work in the med room, you learned your medications. Most of the patients were dual diagnosed, so they had a lot of psych medications as well as their detox medications, and it depends on what they were detoxing from. And that would depend on what we would give them. But if you were working in the med room, you learned your medications that way. If you were not in the med room, you basically just did vitals and, like I said, monitor them. So I stayed there for a year, and I left because I was a brand new nurse, and I really felt like I was losing out on my nursing skills because I really wasn't doing any like full assessments. Although we did have a code there, the code wasn't even one of our patients. It was like somebody who was coming to do group therapy, and he started having chest pains and stuff. But anyway, so I left there. I feel as if that place is a good place for someone who's transitioning, like maybe to retire. It's kind of laid back for that type of person. But for the new nurse, I don't think it's a good gig because, like I said, you don't do a lot of nursing skills and you lose out on that stuff. All right, so next I did home health care briefly, and that place was a setup, again, as a new nurse. I don't know if these are in order. These first three, I think I'm doing them in order. So it was a nurse in rehab. When I went to the interview, she was like, okay, when you come in for your interview, have on your uniform. So I'm like, have on my uniform? I'm not gonna, wear my business casual. She was like, have on your uniform and be ready to work. So I was like, okay. So basically, they really needed help. So she wasn't, this is eco styling jail. So she wasn't really interviewing me. She was basically having me to fill out all my paperwork so that I could go get my assignments. That was pretty cool. It was the type of home health care that it was is you get paid per case. Depending on the case, what you did depended on the money. I never really understood the money because I didn't stay there that long. But like I had one case where the only thing that I did was had to administer this lady her insulin shot in the morning. So every morning I would go over there and to give her her insulin shot. And then I just felt like I had to do something else. I just made sure she had like something to eat or whatnot because her daughter was going out of town. So she needed help while she was out of town to help with her mom. So that was one case. I had another case where I had to go administer a Lovenot shot. I don't understand why they didn't teach this stuff in the hospital. I mean, they could have taught some of this stuff prior to discharge. I mean, the little old lady, maybe not. But this other guy, he was like in his 30s, 40s. He could administer himself a Lovenot shot. So I don't know why I had to waste my gas going over there. But hey, so I taught him. I had to teach him how to do it. I don't know why they didn't teach him in the hospital. But anyway, that was another case. And then I had a case where we had to do a dressing change, which is understandable. It was like in a position where he couldn't really reach it. And then I had one where the patient had a wound vac. Now, I never, at this point in time, never even heard of a wound vac. So she was like, yeah, you got to go over there and change his wound vac dressing. And so these people, when they hire me, they don't know what experience I had. They just threw me out there. So I'm like, y'all not going to follow me around to make sure I know what I'm doing, that I'm qualified? They were like, no, if you need help, you just call this number. I'm like, call this number? Like I said, it was a setup. So they tried to send me out here with this wound vac. And I'm like, I don't know what no wound vac is. So she was like, he could tell you how to do it, the patient. He could tell you how to do it. He's been on it for a while. So I was like, listen, I was like, if you send somebody out here with me at least one time, because I'm the type of nurse that you do one, show one, and then I do one. I mean, I don't mind trying, but show me what the hell I'm doing at least. Y'all, I'm struggling. I don't know. Okay. So she sent out another nurse. I guess the nurse who had the case prior, but she wasn't going to be able to do it anymore. So she sent her out to show me how to do it. I was like, okay, it seems simple enough. Girl, the next time I go out there to do it, that thing would not stop beeping. Jesus Christ. I'm like, sir, what you do? And he was like, well, normally we do this. Girl, that wasn't working. Okay, now what we do? And he ain't have a lot of supplies. So I'm like, man, look at here. So he just got frustrated. He was like, don't worry about it. Now, at the time, like I said, I never heard of a wound vac. So I didn't know to take the wound wax stuff off and to do like a wet to dry dressing or something if you couldn't get the machine to work. I left that machine beeping. Girl, I don't know what he ended up doing. I guess he didn't request me to come back because I ain't go back no more to his house. I don't know. But child, that's how they set you up. And then my last case that I took. Oh, another thing, I didn't like it because they used to send me all the way out in the woods. Like, I ain't had no phone signal. I'm like, I don't know these. I'm got to go in these people's houses. This is not working. So they sent me out to go change out a Foley. Okay, I go there. So I'm trying to do everything by the book. You know, sterile care and everything. Of course, he only had one Foley. Okay, I insert the Foley, and it's a guy. So I'm like, okay, I can't go wrong on the guy. Where, you know, with the lady, you can kind of go wrong. So I put the Foley in, no pee. I'm like, why no pee ain't coming out of this man Foley? So I'm racking my brain. I'm like, okay, Kenya, there's only one hole that you can go in with the guy. I'm in the right hole. So, you know, in the books they tell you, once you insert it, if you take it out, you got to get another Foley kit because you can introduce infection, which is true. Well, he ain't had no other Foley kit. That was the only one. So I'm like, okay, so I'm calling my friend who, you know, graduated with me. I'm like, Felicia, with the man, it's only one hole, right? So she was like, yeah. I was like, because he not getting any, I'm not getting any pee back. So she was like, you in the right spot. So I was like, but he ain't got no pee return. So I was like, I want to go out and do it again, but he don't have no other Foley kits. So I'm like, okay, so I call the place, like they say, call. This puff is not working. So I called. They said, get him to drink some water. That man drank about 8 cups of water, messing around with me, because he wasn't giving back no pee. So I'm like, this is not how this is supposed to go. So the daughter-in-law, she was like, every time we get ready to go somewhere, we end up having to take him to the emergency room. So I was like, oh Lord, they got to go to the emergency room. I done did something to the man. Now I'm feeling bad. I'm like, oh Lord, I done put it in wrong. Now they got to go to the emergency room. So come to find out, the man had prostate issues. So he had an enlarged prostate. So that's why, okay, I think I'm going to just do a pony puff because a high puff is not working. So that was the issue. He had prostate issues. I don't know. Anyway, so I was like, this is not for me because I didn't feel confident enough to be in these people's homes by myself, not really 100% knowing what I was doing. All right, so then, again, I had to get these places, whoever would hire me, because no one was really giving me a shot. All right, so then for 2 weeks, I had training with this another home health care, but they were actually training with me. So I was like, okay, this should be better. This was working with kids, pediatrics. So these kids were like trach kids, kids who were on the ventilator, kids who had G-tubes. So like they really needed like around the clock care, basically. So we had two cases where I trained at. 1 week was this one baby. He was probably like 1. And he was on a ventilator. And so they talked about you got to learn how to change out a trach and all this stuff. And like I said, I did it during skills, but I don't feel comfortable to be in these people's house responsible for their child, and something happens to where the trach is dislodged, and now I'm responsible to put it back in. Oh my gosh. So after I went through that training, the lady was supposed to put me on the schedule by myself, and she never put me on the schedule. She went on vacation. So they were like, you gotta wait till she come back from vacation. So I was like, that's just the Lord telling me, do not take this job where you're responsible for these babies. So since she ain't put me on the schedule, I quit that job because I wasn't ready. Then I had my stint at the nursing home for 3 years. Yeah, you know, the nursing home is a nursing home where you have about 40 patients. By the time I finished my first med pass, it was time for my second med pass, and all these G-tubes getting clogged up, and you got to worry about the patients wandering, trying to escape, and child, that was a mess. They want you to forge stuff on the books, and it was paper charting, so they want you to initial stuff, and you wasn't even there. I'm like, no, I'm not putting my initials next to that. Yeah, that was a hot mess, but I was there for 3 years. So I really learned my medications there. But again, I really wasn't doing anything besides assessments, peg tubes. That's, you know, as far as nursing skills. I wasn't really doing any skills. So I left there. Then I went to a place called Specialty Hospital, which is an LTAC, which is a long-term acute care facility, which is when you leave the hospital, say if you're on a ventilator, you need to be weaned off, or if you have a lot of wounds that need to be healed, you're not ready to go home, but you've basically overstayed your welcome at the hospital. But there that's where I learned the bulk of my stuff, because I worked with drips, I worked with ventilators, of course I had peg tubes, I had wounds, I had everything there. I worked there for about 3 years. So that's 6. And then 6, 7. Something ain't adding up. Then I'm at the hospital where I'm at now. I've been here for 5 years. And I want to do something different. As you all know, I've been thinking about traveling. But I don't know if that's what I want to do. But yeah, so I've done home health care, a drug rehab, pediatric home health care. That was only like a week. Nursing home. It was half nursing, half skilled rehab. Then I was at the LTAC, and now I'm at a progressive unit at the Trauma 1 hospital. So that is my 11 years. I don't know. I got to figure it out, how long I've been at each place. But that's it, you guys. I gave up on my puff, and I'm just going to wear my little ponytail. Probably tie this around it or something. I don't know. And that's it. If you guys watched it to the end, type in the word journey. My nursing journey, I guess. JOURNEY. And don't forget to hit that subscribe button, the bell notification, drop any comments, concerns, and I'll see you guys later. Bye.